as helping professionals, we are typically in a role where we are the helper, and there's a lot of consequences between the us and them distinction, even though it was initially, I think, around a service ethic about serving others. And I think it's an area that can breed stigma and implicit bias. Sometimes we may also get somewhat objectified as opposed to being a person, we're in a role. But the pandemic itself means that the staff have the exact same worries as patients. My husband has cancer. He's older than I am. He's on chemo. And so I stopped going into the clinic to see patients many months ago now. Then I'm doing sessions on the video with patients who are living the exact same anxieties that I'm living. And I can't think of a time that that has happened before. When we say health and when we say health care, the dominant narrative is around medical care. To have behavioral health be primary in the national narrative, to be part of the dominant discourse about health in this country is a first for us. That has never happened. We've been deeply worried since the onset of the pandemic about the behavioral health of patients. And most of us don't know, how does one of our employees get behavioral health services? How does one of our employees get substance use disorder services? And that sort of us-them divide allows that to continue. We use the word provider, we use the word clinician. Hourly wage workers, it's low wage work, it's low paid work. They do not have a choice about whether they're at home or at work. They might be at work when they would rather be at home because they're so scared about at-risk people in their lives. When I came home and went to telehealth, I had many more staff texting me and asking if they could do sessions because it was so much easier because yes, I can do it at 5 after work. Yes, I can do it on Sunday afternoon. I think it more likely, as we get more and more thoughtful about it, is expanding access and improving health equity. We need to talk about the moment that we're in. We need to have conversations about racism and implicit bias in the workplace. I hope we don't rebuild our systems to go back to being based on an 8 and 9 hour workday plus commuting and think that somehow our families and our communities can live in a healthy way on that work model. And I hope that we expand our flexible work conversations to always include our hourly wage workers and see what they want, what works for them, what are the options on the table that would help them have fuller, emotionally and physically healthy lives and families.